The current state of health care for mothers in the U.S. is likely a result of good intentions but major flaws in execution. We have the highest maternal mortality rate out of all industrialized countries, and Black women are suffering the brunt of that with disproportionately higher death and morbidity rates. We also have about 1 in 9 women experiencing perinatal mood disorders such as depression, anxiety, and OCD. Well, when we look into why we have these horrible outcomes, what we're seeing is fragmented systems of care as far as female reproductive health care and birthing care, but also fragmented insurance care. And lots of misinformation is happening for moms as far as prenatal and postpartum care. We also know that social determinants of health like poverty, discrimination, dangerous living conditions are contributing to these morbidities and mortalities for our moms. Well, the mission of the center is to improve the health of mothers and their families through interdisciplinary research and training. So we're really hoping that by bringing the community into our conversations as well as different disciplines, we can come up with creative solutions to meet mothers where they are and help improve health.
The Healthy Start program is a national program funded by the Health Resources and Services Administration, often referred to as HRSA. The program works to improve women's health, promote family well-being, encourage and promote collective impact within communities.
The community needs a program like Healthy Start because our program goes into homes of individuals and works with the family as a whole, with moms, fathers, babies, and we connect them to services. We really try to do that in a respectful, meaningful manner that will help the families work with us to uncover barriers that may not be conducive to them getting maternal health care.
My experience with Healthy Start was very positive. The caseworker that I have, she helps me keep up with my doctor's day, anything concerning the baby, even helping you further your education. They also, at this point in particular time with the pandemic going on, they're shoulder to lean on and an ear to talk to all the time, and just any problems that you're having, you can always talk to them about them. I've been with them for about 3 months now, and it's been going very well.
The center has such great passion and so many great ideas and things that are really coming to fruition that it's going to be great for us to be a part of that, being in the University of Houston College of Medicine and in the communities around us. A lot of what I've seen is a lot more collaboration, which I think is crucial to the effective improvement of health and healthcare of our women in our communities.
We here at the College of Medicine understand that health happens where people live, work, worship, and play. And the only way that we're going to be able to achieve those goals is through collaboration with community partners, such as the Maternal Health Equity Research and Training Center.
I think the future of maternal care needs to look like the collective efforts of all programs that work in the area of maternal and child health. I also think the future of maternal care needs to look like more services being offered to pregnant women through telehealth as an option, but also continuing to address the issue of systemic racism.
To have a future that has health equity for mothers, we really need to keep that framework in mind where everybody has a chance for optimal health during pregnancy and beyond. So we have to look at what are the barriers to optimal and equal equity. And what we see is that people need to focus on reducing the barriers to increase the equity. Barriers such as poverty, structural racism, implicit bias when providers are interacting with moms. We have a lot of repair to do in the community as far as building trust. I think that is something measurable we would see to know we're working towards equity. The role the center will play in achieving health equity for mothers is really helping to change the narrative about how we talk about maternal health. We know what the problems are. We have had plenty of research about that to show these disparities. We need to be focused on the solutions and including mothers' voices to help them feel empowered in their own health.